again, everyone. It's Dr. Tim Newton with Inspire Movement Physical Therapy. In this video, we're going to show you some of the craniosacral assessment and treatment techniques that we like to use for people who have headaches. We're going to show you how we do typical craniosacral treatment techniques, including the assessment. This is a very, very subtle technique, and it's very hard to see, to appreciate, unless you are the patient yourself. So we're going to do the best that we can to try to give you a good angle, and I'll try to demonstrate what I'm doing. But bear in mind, these are very subtle, very gentle techniques. When we go in and do a craniosacral assessment, we have our hands on the patient's head. We are sensing for myofascial tensions, and we're also feeling for the cranial bones themselves. Before we do any kind of craniosacral treatment, we need to realize that any kind of headache or tension in the head, any kind of cranial issue, can be perpetuated when you have a problem in the sacrum or the SI joint, the TMJ, or the upper cervical spine. Okay, that's the top of the neck where it meets the back of the head. Okay, we have videos on each of those and how we treat them. It's very important that those areas are being addressed, because if you don't address them, issues here and tensions here can remain and persist. So check out those if you're interested. We're assuming we've already addressed those, and now we're going right to it. So I start and I just have my hands on the head of the patient. I'll just ask that person to relax, think happy thoughts. It's a very, very gentle, hold that I have here. I'm not squeezing anything. When I'm here in this position, I then feel for the craniosacral rhythm, okay? And really what it is an expansion and contraction that is occurring in the tissues. There's a very subtle back and forth, okay? If there is a back and forth on one side, but the other side's not really doing it, right? I'm exaggerating here by moving my right hand a little bit more. That indicates to me that something may be restricted on the left side. So that's a clue. I can also directly challenge the mobility of those cranial bones by pushing a little bit in specific directions. So what I'm doing here is kind of tilting forward, tilting back, and then I'll do on the sides, I'll go up and down, and I'll even try a little bit of twisting. And that helps me hone in on exactly where the problem is. We have to remember we've got a bunch of different bones that have fused together since we were infants, and they've grown together. And if you look at any skulls, you'll see these zigzagging sutures. Well, there's still a little bit of play there in those joints, and they're significant, especially when you have tight muscles in the back of the neck pulling down on one or two of them, or if you have a history of trauma, right? That gets remembered by these sutures in the skull. They can jam up and be held tight and be a cause of pain. So I go through those motions, tilting down, tilting up. A lot of the time my patients will want to help me, so I have to ask to please relax your head and don't move with me. Up on the side, and you can see maybe a tiny bit of movement with my hands, but it's extremely little. Okay, so I've detected a restriction on the left side. There are other little tests that I could do to confirm and hone in, but I'm going to show you a common area that we treat and that is restricted with her. It is where the occipital bone on the back of the skull meets the temporal bone, okay, that has our hearing apparatus. All right. The suture is right in here, right? It's called the occipito-mastoid suture. The mastoid's part of that temporal bone I just described. So, first technique I'm going to show you is a V-spread for how my fingers go. I just put one finger on each side of where that suture is, and I can feel it when I'm doing this, okay? And then I just take my other hand and go on the opposite side of the skull and give a very, very gentle but directed pressure. And by pressure, that's a misnomer. It's really the touch of a fly. But having the specific position is important. That can help to release myofascial tension through that side. Usually that helps to get things moving better. If it doesn't, I can get a little more direct, and I can just try to move the bones themselves. Now again, this is very, very gentle. This is not brute force by any means. So I just take this bottom hand and stabilize the occipital bone, and I take my hand here and I try to control the temporal bone. And I have to use a 5-finger hold here, including a little bit of ear stabilization. But now I've got my fingers here with this one in the ear. It's kind of hard for you guys to see. It gets very crowded very quickly. And what I'm going to do is also use tension in her body to augment the treatment, so I don't really have to push very hard. I don't want to be pushing hard on her head. I'm going to ask her to pull the toes up on her right foot only and to take a deep breath in, and as she's breathing in, I'm guiding the bone where I want it to go, and I ask her to breathe in just a little bit more and just a little bit more until her lungs are 100% full, and then she relaxes everything. And that was the technique for that suture right there. I was taking advantage of the breath because that helps the whole myofascial system release, and I was just taking that bone and guiding it just a tiny bit, maybe less than a millimeter. Very, very small amounts of movement here we're talking about. But those were two examples of how we treat a particular suture. A general technique that is good, that can really help with decompression, is a lift or a release. A good example is the frontal bone release. Okay, so this is the frontal bone, okay, and it kind of goes along our forehead up to about here. What I'm going to do is just take my hands on either side and kind of clamp it on the sides, and I'm going to lift upward just a tiny bit. I'm not lifting her whole head up. It's just a very gentle tug. This can be very helpful for headaches. You can kind of think of it as a combination of a facial and a head massage. Okay, and that is the frontal lift, and I can hold here for a minute or so, or until I feel a release. And that's pretty much it. So we showed you a lift, we showed you a direct technique for a suture, and we showed you a V-spread technique. These are a couple of different examples that we like for craniosacral and cranial techniques for headaches. All right, everyone, that is the beginning of how we start to treat somebody with craniosacral techniques. If you found this video helpful, don't forget to leave us your questions and your comments, and look for more related material on our website at marylandmanualtherapy.com. Thanks for watching, and have an inspired day.